A patient underwent hip replacement surgery. Dyspnea, pleuritic pain. Even a little child also will answer. First year MBBS student also will answer. Pulmonary embolism. This is a beautiful question. Iska correct answer bolo. I become proud of all of you. pH 7.3, PaCO2 68, bicarbs 28, PaO2 60. What do you like to call this as? It is a respiratory acidosis, all of us know. pH is acidic and PaCO2 is elevated, right? So when pH is decreasing, PaCO2 increasing, they are in the opposite direction means Rome. Respiratory में opposite में जाएगा pH and CO2. ME, ROME, metabolic acidosis में same direction में जाएगा. So that is pH and bicarbonate. So what is your answer, doctor? This question is for sale 23. Deepayan is very sure it is uncompensated respiratory acidosis. But why Manoj thinks partially compensated? Okay, partially compensated, excellent. And Churg also thinks it is uncompensated. Very good. Now, the PCO2 raised, no doctor, 68 millimeters it raised in response to the falling pH. So, that is the reason it is typically considered to be a partially compensated respiratory acidosis is what you need to basically remember. So pH increases, PaCO2, pH increases, bicarbonate also increases, same direction, metabolic alkalosis. pH decreases, bicarb decreases is metabolic acidosis. pH increases but PaCO2 decreases is respiratory alkalosis. And respiratory acidosis is pH decreases but PaCO2 increases is what you need to remember. Once more, when do you call compensated, partially compensated? If it is compensated, the pH will return normal. But here it is 7.3. It has not yet returned normal. So that is the reason it is partially compensated. Respiratory acidosis is what you have to be emphatically sure about. 40-year-old hematuria, ecchymoses, menorrhagia, 40-year-old women. So, what is the most likely diagnosis? This question is also for sale. Shoot your answer, doctor. Question number 24. Let me check how good you are in this topic. Dawn thinks ITP. ITP, 6 months duration, doctor. Rituraj also is seduced by the ITP. Okay, ITP, alright. There is a ecchymoses, menorrhagia also. Okay, agreed, ITP. Now, motor nerve is involved in case of the lead poisoning. So, you should be sure Guillain-Barré and CIDP, then emidaron toxicity, lead poisoning, they are all motor neuropathies. Whereas arsenic, thallium, they are all sensory neuropathies. That's what you have to be very sure. What are the causes of the autonomic neuropathy versus pure sensory neuropathy, motor neuropathy, the list of causes you should be very sure. There is a skin necrosis 3 days after being started with warfarin. So what is the likely mechanism? Basically, in the blood you have, this is an example of after giving warfarin, painful erythema purpura necrosis called warfarin induced necrosis can occur typically between 3rd to 10th day. That is the reason, one of the important thing to remember is, whenever you start warfarin first time, you should also add heparin to that until the warfarin takes over, anticoagulant action of the warfarin takes over. Until then you have to overlap it with the heparin. Now if you look at the clotting and bleeding system. You have all procoagulants. 2, 7, 9, 10, all these are procoagulants. If you give warfarin, they will be inactivated. So that is the reason warfarin is anticoagulant. But the bleeding is basically caused by the natural anticoagulants, protein C, protein S. Unfortunately, even these protein C, protein S are also vitamin K dependent. So that is the reason if protein C, protein S happen to get inactivated if you give warfarin, which is anti-vitamin K, if vitamin K is not there, protein C, protein S also become dysfunctional. Then the normal anticoagulant activity, if it is antagonized, what will happen? It become procoagulant state. So that is the reason there will be a thrombotic tendency paradoxically. So now I will explain it on the board. So this is one important funda which you need to basically remember when you go to the exam. Vitamin K dependent clotting factors. What are they? 2, 7, 9 and 10. These are procoagulant. Whereas protein C, protein S, they are anticoagulant. They are also vitamin K dependent. If you give warfarin, which is anti-vitamin K, the protein C, protein S are inhibited, even 2, 7, 9, 10 inhibited. If the anti-clotting factors are inhibited, what will happen? Clotting will happen. If procoagulants are inhibited, what will happen? Anticoagulation will happen. Anticoagulation will happen. But if you look at the half-life of protein C, protein S, it is much shorter than the procoagulant factors. So the moment you give warfarin, first to get inhibited are protein C, protein S. The first tendency is a clotting tendency. Later, the anticoagulant tendency will appear. And why do we use warfarin for? Mainly for anticoagulant. But what is the problem with that? Initially, there is a clotting tendency because of the inactivation of protein C, protein S. That is the reason, unless you add heparin to the warfarin, you cannot be able to prevent the initial coagulating tendency. And because of this, the clots form. They go to the small vessels supplying the skin, and they typically lead to the clotting of that, and that lead to skin necrosis. Initially, when you start the warfarin, is what you have to basically remember. So that is all the story about the warfarin. After this session is over, you should pick up antiplatelet drugs, thrombolytics, fibrinolytics, antifibrinolytics, and coagulation cascade. Invariably, one question is going to come, which you will never, you cannot escape. Now, why protein C, protein S are naturally anti-clotting in nature? What is their mechanism? Typically, protein C, protein S, they degrade the factor 8A and also they degrade the factor 5A. Normally, the blood is created in such a way that a homeostasis builds. Either the ruling party should not be too powerful or the opposition party should not be too powerful. If opposition party is too powerful, any moment the ruling party, they can pass a no confidence motion and can dismantle the government. If the ruling party wins full majority, it will behave like a dictator and the opposition will become weak. So that is the reason God has created the coagulant, anticoagulant, both the things He has kept so that nothing will dominate the other. So protein C, protein S is that. So Few people have factor V Leiden. What is the meaning of factor V Leiden? Though in those people, the factor V, which is normally degraded by the protein C, protein S, it cannot be degraded. Factor V Leiden mutation people. So that is the reason the factor V activity become unopposed, and that is the reason they develop the thrombotic tendency. Factor V Leiden mutation is what you need to remember. So protein C will be stimulated to form active protein C by the thrombin. The active protein C and protein S together, they will lead to the inactivation of the factor 5A and factor 8A is what you have to basically remember. A 15-year-old boy is brought to the emergency. 2 days history of headache, vomiting, altered sensorium, ecchymoses. Classically, it is a meningitis leading to meningococcal septicemia, Neisseria meningitides. There is an episode of hematuria immediately after a sore throat and a respiratory infection. What is that called? Synpharyngitic hematuria, typically seen in the case of the IgA nephropathy. What is the difference between this and post-streptococcal glomerulonephritis? Even post-streptococcal glomerulonephritis also, there is a hematuria after a sore throat. But at least there is a 3 weeks of duration between the sore throat and the hematuria. But in IgA nephropathy, sore throat आ गया, कल hematuria आ गया. What is that called? Synpharyngitic hematuria is the feature of the IgA nephropathy.